morning, everyone. My name is Ursula Lawrence. I am the Vice President, Chief Nursing Officer at Mobile Infirmary. Mobile Infirmary is the largest hospital of infirmary health. There's three. There's Mobile Infirmary, Thomas Hospital here in Fairhope, and North Baldwin in Bay Minette. The next slide that I kind of want to show you is kind of our COVID numbers. And you can see that this starts from April of 2020 and goes on to August of 2021. And you'll see different peaks that are occurring through this whole COVID virus that has been hitting our counties as well as in the United States. And what we're in now is what I call our fourth cycle, our fourth phase. And so our first cycle happened in March. And so you can see that first bump, lasted through probably May. And then our second bump kind of started to happen in July, August. And so every single time you see that little bump, we always try to say, why did this happen? And we always kind of pull it together with the dropping of the face masks, the opening of the cities back up, schools reopening, holidays, families getting together for holidays. And so we would follow back about 2 weeks afterwards to see a spike. And you can see the second spike is higher than the first spike. And then there's a third spike, and that spike happened in January, right after the holidays. And that spike is even higher. Our census went higher. And during this period, you have to remember that vaccinations came into play in December. Okay, so people were trying to get vaccinated. But that third spike, what has to happen in the hospital is we have to divert beds to take care of the new virus, the new disease that people are coming in with for COVID. Now, we're a full hospital before COVID even came into play. Lots of surgeries, lots of procedures, taking care of heart attacks, taking care of strokes, taking care of some traumas that come to our hospital. And so what happens, it diverts us from caring for those patients because we got to make room for these patients that are sick with COVID. And I know that there's a lot of you that can say, is this real? Is it really happening? And I'll tell you, I live it every day. And I walk those floors. Those floors become locked down. You have to have PPE, which is personal protective equipment. You guys all have face masks. And those face masks that you guys are wearing are 3-ply. This face mask that I'm wearing is a 4-ply. The one that Dr. Admire is wearing is a 5-ply. And so every time you add a layer, that's less filtration that's going through that mask. Now think that the nurses are probably wearing even a thicker mask. And they have to wear that for 12 hours because they are on the COVID unit with these patients. If you go ahead and you put one of those masks on for 12 hours, tell me how you feel. So now you can see we're in our fourth peak. And that's where that big blue line is. It's a lot higher than the other 3 peaks. This is our fourth cycle of going through COVID. And it's steeper. It happened quicker. We couldn't come up for a breath. Okay? So one day, August 1st, I have 8 patients on the unit. None of them have any ventilators on. And then a month later, I have 119 patients. Pretty quick. That's a pretty steep process. The staff feel very defeated right now. They can't believe we're doing this again. A majority of our patients are not vaccinated. Patients are dying. The average patient that is in the ICU age is 52. That is a big shift to what we had before. Our patients from the nursing home is not as high as during our first 3 waves. And the reason why is they're vaccinated. The nursing homes are vaccinated. Let's kind of go to the next slide. The next slide talks about the state of Alabama. Believe it or not, we get a report every morning that has to be put in by all the hospitals. It's the Alabama Incident Management System. we reached a peak of over 200 patients with COVID. It's the highest we ever had. We had to go to another floor. We had to close our psychiatric unit. And the hardest thing that staff has to do is to watch somebody die. And that's happening quite a bit right now. And it's not someone that's 80 or 90 years old. It's someone who's 23 years old and was unvaccinated. All the patients in the medical ICU that are on a ventilator have not had the vaccine.
Good morning, everyone. Bill Admeyer, doctor at Mobile Infirmary, North Baldwin, and Thomas Hospital's Chief Medical Officer, Vice President. I'm honored to be here today, invited by Mr. Shawn Esfahani to speak with all of you who are employees at a very excellent institution called Eastern Shore Toyota, Eastern Shore Hyundai. What an incredible man. I've known Shawn 14 years. We're very, very close friends. He invited me here today, Ursula and I, to speak to you about what's going on in our country. It's amazing. We're having a crisis, and it's also global. I asked Shawn if I could talk about him, and he gave me permission. So let me tell you, back in December, I was called by a friend of Shawn's. He said, "Bill, you need to go see Shawn at his house." I said, "What's wrong?" "He's sick." The following day, I called to his house, and he was very, very sick. I called an ambulance, 911. They picked Shawn up, took him to the Mobile Infirmary. Ursula and I called ahead, and we admitted him to the intensive care unit. And when I tell you this is no exaggeration. For the next 4 days, he fought for his life. He was probably minutes away from being put on a ventilator, which is not a good thing to do because mortality is so high on ventilators. But the doctors there, the critical care, pulmonologists, and the nurses put him on BiPAP, CPAP, continuous positive airway pressure. We gave him every medicine known to give to COVID patients. We hit him with corticosteroids, antibiotics, fluids, and his x-ray of his lungs. One pulmonologist told me, I said to him, "Doctor, how's Mr. Esfahani doing?" He goes, "Bill, it doesn't look good. I don't know if he's going to make it." I mean, that was shocking. I looked at his x-ray and said, "Oh my God." So I put all my PPE on, took Ursula with me. We went up and saw him in the ICU because no one was going into the ICU except the brave nurses and brave doctors and ancillary staff that take care of patients. And he was lying in bed, and he was in bad shape, critical. And had the worst chest x-ray of all the patients in the hospital, whited out lungs. I said, "Oh God." I told Ursula, "I'm not sure what's going to happen here." Here he is today. And that is why he has a passion now, doing what he does, $100,000 to the community on the raffles each week. What all that's doing is showing support to a community that's in trouble. And the hospitals and the healthcare community are in trouble, and all of us, we're right in the middle of it. So with that being said, this pandemic started in December of 2019 in Wuhan, China. Coronavirus. But for some reason, in 2019, the coronavirus became lethal. We don't know why. A lot of conspiracy theories, we're not going to go there. That's what you can look up on the internet. 4.2 million people have died from COVID already globally. 630,000 USA citizens have died from COVID because of the Delta variant. It's here. And it's even mutating itself. It could become a super Delta. We got to worry about the Lambda, the Epsilon, the Gamma, all these others. There's 13 variants that are washing around the globe right now. At the current rate, we give 37 million doses a day of the vaccine around the world. Okay? In the United States, we're giving somewhere around 650,000 doses a day. It's going to take 5 to 6 months for us to get to a 75% fully vaccinated global, and the United States also. We need to uptick that. We need to get it quicker. Because if you get vaccinated quicker, what happens? You prevent the disease from spreading, you prevent hospitalizations, and you prevent mortality from rising. We are now in a pandemic of the unvaccinated. That's statistical. That's analytical data. That's science. Ursula said that all the deaths, 99% plus of all deaths now that occur in a hospital are unvaccinated in the ICUs. Unvaccinated people are 3 times more likely to contact COVID. Unvaccinated people are 8 times more likely to have symptoms and get sick. Unvaccinated people are 25 more times likely to be admitted to a hospital. In the United States, we have given 337 million vaccination shots so far. You know how many shots we've given around the world? 4.5 billion shots of vaccines. But yet, if you read the internet, all of these stories out there about vaccination, and I'm passionate about this because I don't like seeing people die in the hospital. The number one thing you can do is get vaccinated. Number 2 thing is wear a mask, avoid spreading, social distance, and you're all doing that, personal hygiene. You might have to even stop shaking hands, give you a little bump on the elbow. That's fine. A little bit of a culture change for right now. Maybe they'll stay that way. I'm not sure, but it doesn't matter. We have to be safe. It's going to take a while to get through this pandemic. Even if you're vaccinated, you can have breakthrough cases. Unlikely, but you can. You've heard of people getting COVID twice after they've gotten vaccinated. But they don't get nearly as sick. They don't get hospitalized. They're not dying. That's the good thing. It does protect you from contacting disease, getting very sick, going to the hospital, and mortality. Proven. 18 to 35, 8 months ago, you were 7% of COVID cases. Now you're up to 18%. That's significant. It's going to the younger people. Ursula mentioned our ICU patients are now in their early 50s. We've had a 23-year-old young male die at the infirmary last week. 28-year-old female. Young lady in her mid-30s. In their 40s and 50s. We're seeing that happen. It's crushing the nurses and the doctors to see young people die when it is preventable. 35.6% vaccinated. Why do you think we're having such a surge right now? Overwhelming our hospitals, ICUs, emergency departments, urgent cares, doctors' offices. That's what's happening. Why is the federal government getting involved now, looking at us, along with Louisiana, Mississippi, Texas, Arkansas? Teams of 35 plus professionals coming in to help the hospitals that can't take care of all the patients because it's overwhelming. But you don't realize the healthcare workers in America are struggling. Burnout, fatigue, watching people die, it affects you. We're asking for your help. I'm asking you just to think of the information I've given you and make an informed decision. If you can be vaccinated, you help yourself, I promise you. It's very safe. And number 2, you're protecting others. The pediatric admissions at USA and other pediatric hospitals in Alabama are on the rise right now, and there's some of these little children on ventilators. So I'm asking people to think of that when you make a personal decision. And believe me, I believe in personal decision. And I'd love to Ursula come up here, and if you have any questions, answer, we can give you the answers. If not, I'll ask Gary and Shawn. You want to come up to that person? Tony.
Can you talk about as opposed to how vaccine is used to do?
Question was, can I tell you about how the new vaccine, the messenger RNA, was done so quickly? And the answer is, it wasn't done quickly. 31 years of study, experimental, in the lab, University of Pennsylvania, Pittsburgh, Wisconsin, all involved in messenger RNA technology, female physician. They told her it wouldn't work. She didn't give up. Honestly, if I had a vote, she'd get the Nobel Prize. Any other questions?
How much of this news media affected the health and the wealth of this country? What are they costing by creating confusion versus science, statistical data?
the media, on TV, or social media, or radio, whatever you listen to or watch, has it had on this pandemic? I think it's been overwhelming impact. When you only get, we had a struggle to get even 50% of our adult population vaccinated. 50 years ago, there had been no question. Times have changed, I understand that. Libertarians are there, independents, that's fine. Everybody make your own choice. But if the science and evidence-based is there, and the data and the analytics, and for some reason our culture has changed, and I say, why? It hurts me, because I don't want people dying. I don't want people sick. I think this is preventable. The answer to Shawn is, it's been a tremendous impact on our society, and we can make a difference if we just collectively right now make that concerted effort. Thank you.